Hi, everyone. As we continue our mental health focus during the month of May, we've got a great topic for you today. We are joined by the chair of the Department of Psychiatry for Texas Tech University Health Sciences Center, Dr. Sarah Wakefield. Thanks for being with us today.
Happy to be here. Thanks for having me.
Before we get started on our chat, we always like to hear sort of where you've come from. How are you here at Texas Tech? And give us a little backstory on you.
All right. Well, I am actually from a small East Texas town, from Terrell, Texas, and I grew up there and then went off to Virginia for undergraduate education and was able to come back to Texas for medical school. So I came out to West Texas. My dad's actually grew up in Abilene. And I remember one of my favorite stories is I did my residency training in Louisiana, and he came out to see me and have dinner with me. And I was pregnant with his second grandchild. And I said, I have a couple of pieces of news for you. We may be going to Lubbock, Texas, to Texas Tech Health Sciences Center. And I'm pregnant with your second grandchild. And he said, you are going to love West Texas. And he was right. And so that's really, we made our way out here because they needed a child and adolescent psychiatrist and had a great program for graduate school for my husband. And it was a good fit for us.
Well, that is wonderful. That's a great story. I love that. Well, let's kind of get into our discussion of COVID today. And, you know, in your space, people have really been reacting to COVID in a variety of ways. I think you've mentioned it in sort of waves, right? We are reacting and interacting with COVID in several different ways. That last wave of the 4 responses is sort of a mental health response. Can you kind of take us through what that looks like and maybe where we are in that whole reaction space?
Yeah, sure. So I think, you know, where we are in the wave will always be easier to see in retrospect. And so I'm not sure I can exactly tell you that today, but we can kind of talk about how we move as a society through that 4th wave. Really, to do that, we have to talk about the first 3 waves. The first wave is definitely where we are right now, where we are moving, responding to this initial anxiety of this COVID pandemic. So the first wave of a pandemic is really the acute medical response, right? Isolating, figuring out, tracing, treating, if at all possible, the pandemic, the reason for the pandemic. But what happens in that time period is very anxiety provoking. It's anxiety provoking because you're not sure what the future holds. It's anxiety provoking because there are major changes. And so that's what really kicks off what we think about as the 4th wave, that mental health wave of the pandemic. And we think about it as the 4th wave, not because it comes forth, it comes, you know, 4th in line, but because it keeps going beyond the first 3 waves. It actually starts as soon as that first wave of the pandemic starts. The second wave is as the pandemic response is concluding, or as it's waning, as we're getting our feet under us, we're understanding what we need to do, which is where I would say we are right now. Then we start to see that a lot of people with acute medical issues that didn't come for treatment because of the pandemic are showing up to the hospital. So the second wave for many of our hospitals are those acute conditions that weren't getting attention during that first wave of the pandemic. So you can see that then we add, you know, people are sicker or people are more concerned. They may still be isolated, and now they're having to deal with these acute medical conditions for themselves, for their family members. So that continues to provide this anxiety. And then we still don't know quite what the future holds for the first wave of that pandemic. And then the third wave is we really think about those chronic conditions that people have not been attending to because of the pandemic. And we know that when we have chronic conditions, chronic medical conditions, the stress with those increases both anxiety and depression. So each of those 3 waves increases the 4th wave of that mental health response.
I mean, it is interesting because you are having those mental health responses with each of those, and they are very different. I think one of the things too that people are experiencing now, I mean, obviously COVID is a respiratory illness, but you have those reactions and those absolute, key responses mentally and emotionally. Even you're experiencing grief, you're experiencing loss. There are a lot of things you're going through. How can people cope right now?
Well, I think, coping is something that we have to do all of the time. And I love that we're talking more about it now, because coping isn't, restricted just to the response of a pandemic. It's really part of the human condition. And so how do we cope? Well, let's look at how we cope in general and really strengthen some of those responses and make sure we are relying on those. When I think about coping, I think about positive and negative coping responses. All coping helps us feel better, at least in the immediacy, right? And so I think about coping, positive coping mechanisms are those mechanisms that help you keep feeling better. And negative coping mechanisms are those mechanisms that make you feel better right this second, but may breed additional problems or even worse problems in the future. So then it becomes kind of easy to see which ones are positive and which ones are negative. If you have, if you like to do yoga, if you like to have, if you like to read, if you like to journal, if you like to run, and exercise and things like that, especially out here on the South Plains, you're still able to do those things. And so I think those are positive coping mechanisms, right? You are able to feel better right this second, release those endorphins, release those positive thoughts, and perspectives, but then you are not causing additional problems in the future. Now, negative coping mechanisms are some things that we see usually very commonly related to addictions. And sometimes, related to maybe not an addiction, but just an overuse of a substance that may cause additional problems in the future.
I think overuse of a substance as opposed to addiction, that is something that a lot of people are probably experiencing. I mean, even if it's opening a cabinet and you're eating too many crackers, right? Like, those are the ways that we are coping,
Yes. And it's very easy to do, right? I mean, it's one of these things that I think to say that it's this terrible thing is to minimize how easy and common it is for all of us to do, right? Especially when you are isolated in an environment and then you have these substances that do make you feel better, whether it is eating too many chips or having French fries late at night delivered to your door, or having, an extra cake, or too much alcohol or another substance, that it really sometimes feels like that's the easiest thing to reach to feel better right this second, but it can cause additional problems. The other thing that I think about is that many times when we're not physically going into work and we're staying home, we're on vacation, right? And vacation brings with it a much different life.
I am glad you're mentioning this, because you're right. You are exactly right. I feel like I've been on a 2.5 month vacation while working, it's very interesting.
It is very interesting. And I think it can be a very difficult thing for your mind to figure out, right? And so our minds don't need, minute to minute scheduling and structure. I mean, there's definitely time that we need our minds to wander. We need to do other things, but we need some general structure to our life. That's very helpful. It calms our anxieties down. So one of the things that can contribute to anxiety is just having this, very, very little structure. And that can be great for a week on vacation. And it's okay for a week on vacation to overeat or maybe drink an extra cocktail, something like that. But when we are doing this continuously over a long period of time, especially when we have other responsibilities, this can really get in the way of our functioning.
Very interesting. What you mentioned earlier, being isolated too. Is there a way that we can be sort of, socially isolated, but not really? Any advice on staying connected to the outside world?
Well, I can tell you that one of the things that I think has kind of been a travesty is that we have used this word social isolation when we really mean physical isolation. We really don't mean social isolation, right? We mean that we want you to stay more than 6 feet apart from another person, not go around, especially if you're in a vulnerable position because of illness or age or other condition, that you are not, going around other people, that you would be exposed. We don't mean that you don't have a social experience. And so it's really important to continue those social experiences. I mean, humans are social creatures. And I've said this multiple times, that I am not a huge fan of technology, or I haven't been in the past. But I say, I really think in the past that it's limited our social interactions. But in this time, I mean, how phenomenal is this that we can continue to have social interactions by the use of technology that we couldn't have otherwise. So I think it's absolutely imperative that we keep having these social interactions, and people are figuring out how to do that over time, but it has been a change. It's a whole new way of thinking about things, and a big learning curve.
I love that you reposition that. Thank you for doing that. Okay, another thing that we want to talk about, and that you have an expertise in this, people tend to relapse if they are in some sort of recovery program or something when they're during crises like this. You've partnered with Covenant Health to open a new chemical dependency clinic here in Lubbock, right? Tell us a little bit more about that project and how that's going to benefit the community.
Yeah, so we're really excited here at Texas Tech Physicians. Our Department of Psychiatry in Lubbock has partnered with Covenant Health. We have a long partnership with Covenant Health for mental health care of our citizens. And this is another project that both organizations wanted to undertake to really serve some of our citizens with substance use disorders and chemical dependency. And it's been a long time. It's been in development for a while. So this wasn't just in response to the COVID pandemic, but it did open in, right as the pandemic was starting. So interestingly, that caused us to revamp a lot of things that we had previously put into place for procedures. But it also came at a time that I think has been really crucial for our community.
I think probably as we wrap this up, it's important for everybody to know out there, if they need help, there are ways to get that help even during a pandemic.
Absolutely. So what has been very clear to me is that we've been able to continue services throughout this time. We actually haven't stopped any of our services. We continued our inpatient unit. We continue our consult services with both of the major hospitals in town. And then we also have continued all of our clinical services, the chemical dependency, intensive outpatient program, and our basic medication management assessment therapy services that we provide in our clinic. We've been able to do some of this via telemedicine so that we can keep everybody as safe as possible, but we have continued in-person services too when it's appropriate. So we are here to serve our citizens, and that care doesn't stop because of a pandemic. So like all of us, we've had to change some things and learn some new ways and be really adaptable, but we are still here and we're excited to be.
Well, we are certainly grateful for all of the work that you do. That wraps up the serious part of our interview, Dr. Wakefield. Are you ready for the lightning round?
I don't know.
I'm going to get a theme song. Don't worry, that's coming. First question. It's a tough one. Crunchy or smooth?
Ooh, crunchy.
People say that I inadvertently judge everyone who says crunchy. And I have to be honest, I'm just shocked about the crunchy. There are so many crunchy enthusiasts out there. Okay, ice cream flavor, what's your favorite one?
Oh, cookies and cream.
Do you have a particular brand that you fancy more than others?
Bluebell. I'm from Texas.
Okay.
Come on.
Oh, there you go. Okay, now this one's controversial. Pineapple on a pizza or no way?
Oh, yes.
Oh, really? Okay. Now let's say there is a movie made about your life or this situation that we find ourselves in. Who is the actress that plays you?
Oh my goodness. I mean, I've never even thought about this question before.
I thought about it so much.
I was just talking about her last night, so I'm going to say Sandra Bullock.
Good call. We like that. That's a good one. Okay, last question. Are you ready?
Yes.
First concert you ever attended?
REM.
Wow, that's so hip of you.
Actually, it was probably the Beach Boys with my dad long before that, but the first concert of my own choosing.
I love that. Location, do you remember where it was?
Yes, Dallas, Texas. I think it was called Starplex at the time.
It's changed names many a time, for sure. Hey, Dr. Wakefield, thanks for hanging out with us today. Thanks for all the advice. Really, really great to talk to you.
My pleasure. Lots of fun. Take care.